So today I'm going to demonstrate how to change an abdominal wound dressing change. So I get an order from doctor already and I verified the order already. So I right now just going to introduce myself to the patient. And that's for patient Jerry Mott. So enter the room and then do the safety check, no safety issues. Hi Jerry, my name is Yan. I'm going to be your student nurse today. Can you tell me your full name? Jerry Mott, your date of birth? 1981 November 1st. Okay. Can I see your armband? Jerry Mott, 1981 November 1st. So I have a right patient. So Jerry, I'm come here for to change your abdominal wound dressing change. And then before we do that, do you need any pain medication? No. So patient doesn't need anything. So Jerry, and then just let me prepare my sterile field first, okay? Okay, just wash my hands and then open my sterile field. Now I don't need this one, I'm just going to throw into the garbage. I don't need this one as well. Take this one out. Now add my supply to this, the field. So this is I need a syringe. I need my scissors. Need my cannula. And my codex. My Q-tips as well. Just need to add one more. Now I'm just going to add one more 4x4 gauze, just in case I don't have enough. Then right now I'm going to pull out my normal saline. So I checked that it's not expired, it's a brand new one. It's in good condition. Now I'm just going to remove Jerry's old dressing. So I just wash my hands and then apply my clean gloves. So Jerry, I'm just going to remove your old dressing, okay? So you can see this is about 10% of serous sanguineous on the abdominal pad. And it's about 50% of serous sanguineous on the 4x4 gauze. I use my forceps just to remove all the codex. And it's about 15% of serous sanguineous, and I just throw them away. And then the wound is no additional odor noticed, and then no additional drainage as well. And then I'm just going to remove all the gloves and then clean my hands. So Jerry, can you move by the side to apply my my gloves, my sterile gloves? Okay, thanks. going to irrigate the wound with normal saline. Let's go to the garbage. And let's go to the shower container. Now we'll irrigate the wound from the center to the outer. And the entry is run clear, and I see it's run clear already, so I'm just going to throw it. And I'm going to just dry it. So we use 4x4 gauze. And I'll make sure my forceps doesn't touch the wound. And we're going to just have one more. Then we're just going to clean the peri wound. And dip into the normal saline, remove the extra. Now we'll clean from the cleanser side to the dirty side, and then from the top to bottom. And clean the other side. Top to bottom as well. And then we're going to dry it. Same procedure as cleaning. Top to bottom. Then the other side, top to bottom. Now we're just going to measure the wound and then do the assessing. So I'm checking this like no tunneling and undermining for the wound. And then I'm just going to measure the depth. And then we have a ruler here. So it's about like 3 centimeters deep. The length is about like 12 centimeters. And the width is about 3 centimeters as well. And now we can see the wound. There's like a granulation tissue inside already. The peri wound is like is pink, no edema noticed, and then looks like very healthy. Now we're just going to pack it with Colex. So we'll soak with normal saline first. And then remove the additional. So that's why a little bit out, that's okay, because we're almost like done over there. We don't need the depth field. We'll estimate like how much we need. Okay, that's good. Now we're going to pack with Q-tips. I'll try my best to like not touching the peri wound, but in case we touch, that's okay because we cleaned the wound, the peri wound already. Jerry, are you doing okay? Yeah? Just want to make sure like we're not like overpacking it, and I'm not packing like too hard, too tight. So I'm just going to cut it. Then I don't need this anymore. And then just pack the rest with the Q-tip. It's good. And then right now we're going to cover 2 4x4 gauze. And cover with another one. Now I consider myself as not sterile anymore, and I'm just going to cover with a abdominal pad. Now I'm just going to tape it. And I just remove my gloves and then clean my hands. And then we're going to clean all these ones, and then we're going to document what I did today. So there was like a 10% of sterile sanguineous on the old abdominal pad, about 50% of sterile sanguineous on the 2 4x4 gauze, and about 15% of sterile sanguineous on all the colex. And the wound was no order, and then no additional, no discharge noticed. And then we irrigated with normal saline, and then we packed it with colex moisture with normal saline, and then the wound itself was healthy. The peri wound was pink, and then no edema, and then no signs of infection noticed. There was a granulation tissue inside already. So we packed it with moisture. We packed it with colex and the moisture with normal saline, and the 2 4x4 gauze and the 1 abdominal pad. And the patient tolerated well. And then when we exit the patient's room, and then we will check the safety issue again, and then we'll make sure the call bell is within reach patient's hands. And that's it.